And we're back. It's Dr. J here. Evan, it's been a while, my man. What's up?
I know. Well, we've been so busy. We talk and talk and talk like, hey, we're ready to help people, and then we get so booked up that we have to make our hangout sessions like in 2 week spurts now. So we'll have to make sure we carve out time for each other.
Totally, man. Oh, by the way, see those windows behind me there?
I do.
I got a little echo there. Sorry about that. Can you hear me still?
Yeah. Can you hear me?
Oh, sorry about that. I got a little dual echo. The YouTube video started playing with your voice, and I was like having deja vu all over again. But the windows behind me there, we got shutters coming in, so I got to get the heck out of my office after this call so the installers can go put my nest little shutters in there.
Oh,
So
good.
pretty stoked on that. That way I can control the light just the way I like it, which is nice. And then all's going well, man. Lots of patients this week digging in back from the long weekend. Did some ribs on Monday, I should say. So we did some ribs, tried to do it as the highest quality as possible, hormone-free, antibiotic-free. I think try to go pasture-fed as much as possible. They didn't have full organic, but that was fun. Did a nice little slow smoke, which was great. Made a nice little barbecue sauce, had a little apple cider vinegar, some mustard, and a tiny bit of honey, just a little bit, coated that thing up. It was great. Really good meal. How was your holiday weekend?
It was great, man. I mean, we've had perfect weather. I can't complain. It's blue skies, 75, 80 degrees here. So it's not blistering hot like it may be in Austin. Been playing outside with the baby, getting her dirty, getting her probiotics. And so she's a barefoot girl just crawling around the yard.
That's great. Yeah, my grass is coming in really green this year. I decided I'm going to put some extra water in there, paid for a little organic chem-free Austin to come by and put some natural kind of more probiotic type of fertilizer on there. It's so funny. They're talking about feeding the grass and how getting the grass's microbiome better with probiotics and all these things. I'm like, I kind of know what you're talking about.
That's sweet. Yeah, I mean, I've got neighbors that are spraying Roundup, so completely opposite end of the spectrum in terms of lawn care. If anybody's using Roundup, it damages your mitochondria. It's not good for you. And if you type in glyphosate autism, you can look at those comparison charts. Especially the thing that broke my heart was last week, the neighbor across the street did a huge bottle of Roundup around all of his shrubs and trees and things like that. And then 5 or 10 minutes later, he's got 3 young kids below 5 years old. All the kids are playing and rolling around in the grass right where he had just sprayed. And I was like, oh God, I just wanted to go over there so bad, but it just wasn't my place.
Yeah, I mean, we still use some more organic or natural stuff that are based on some of the probiotics, some of those things. But still, like, I don't let my wife or myself even go outside, even within a day or two of that being put down, even though it's natural, just because, you just don't know getting high doses of it. Typically after a day or two, it gets absorbed in there. We're avoiding anything carcinogenic and, of course, Roundup as well.
Yeah, Roundup is glyphosate. That's just the brand name Roundup. But I can test for that. And we've seen crazy levels with people. And I had one lady who she was in her garden. She did use glyphosate around the perimeter of her garden, but she was spraying it with no shoes on. And I'm guessing her just stepping in the soil, she absorbed the glyphosate through her feet is my guess. And so she was off the charts with glyphosate, which you can eliminate with the sauna, but why put a carcinogen in your body if you don't have to? And obviously, if you're not eating organic, then you're getting glyphosate that way too. William Shaw, when I interviewed him on the podcast like a month ago, he chatted about this. These 2 twin boys. One had an obsession with eating corn tortillas, and they were conventional corn tortillas. His glyphosate was through the roof, and he had autism. The other twin did not. As soon as Dr. Shaw said, hey, look, cut out the corn completely from the kid's diet, even without implementing detoxification protocols, the kid magically got better and the autism basically went away just by eliminating corn that was so contaminated with glyphosate. So
yeah, I mean, plus corn has that protein zein in it, which can be cross-reactive with gluten. And also, there's some lectins and some gut-irritating compounds in there. And again, some people say, hey, you shouldn't be a zealot regarding grains. But my opinion is get clean, get really, really clean, see how much improvement happens. And then, maybe some of those cheats can exist on the 20% side. I still don't recommend gluten slipping in there unless you aren't that sensitive and it's like special occasions like a birthday or a holiday. But with myself, I just don't want to feel like crap, man. I'm so addicted to feeling great. I just want to be at that highest level all the time. It's not fun being gassy and brain foggy and moody and all that stuff. It's just not worth it.
I know. I had a client this morning. She told me how she went to a gastroenterologist. I'm guessing they wanted to test her for celiac. I didn't ask about the details, but she said they were instructing her to eat gluten, 2 slices of bread every day for a month, and then they were going to do a scope. Is that for celiac or what was that? And why is that? That seems like the dumbest thing I've ever heard of.
Yeah, they were probably doing a challenge test. The problem is people that are really sensitive, and you're going to be suffering. And then the question is, well, how long is that inflammation going to take to go down? And then what if you have an infection in there as well? That could continue to keep the gut somewhat permeable and allow you to have allergenicity to other foods you're eating, right?
What if you trigger? What if you trigger antibodies though? What if you trigger Hashimoto's in yourself, and then you're like, well, oops. I mean, then you're really having to backtrack. I mean, that just seems crazy for conventional doctors to do these type of testing. And not to mention, I think you and I've discussed it before, but anytime you're concerned about, am I actually sensitive to gluten or not? You don't really need to test. Just, you're going to be better off with it. There's so much research now. It's going to cause leaky gut no matter if you're celiac or not. So putting yourself through that misery, getting an endoscope done with possibly picking up antibiotic resistant bacteria from the dirty scope. There's some risky procedures out there that are done every single day. So hopefully we can save a couple people from that.
Oh, absolutely. Plus, when you look at what's happening with a lot of these people, the interesting thing is conventional medicine is looking at for 80%, atrophy of the microvilli. They're looking for 80% destruction. What if you don't have 80%?
What if you're 79% destruction? Yeah, what if you don't have celiac?
I know. So then you're stuck in this kind of middle of the road where, is the doctor going to tell you, hey, go back home and get sick where our tests aren't sensitive enough, get more sick so we can pick you up, or well, you do something else. Like some of the things we test, we see a lot of patients with gliadin antibodies or anti-gliadin, which is the protein primarily in gluten-containing breads or grains. Typically, when people say gluten, they're kind of bastardizing it. They really mean gliadin, right? Gluten is just kind of the slang word for gliadin. Gliadin's primarily in wheat, but in general, typically gluten has come to mean the proteins in wheat, barley, and rye specifically. And then we kind of have our cross-reactive glutens like corn and rice and sorghum and millet and those kind of things.
Yeah, amaranth, quinoa, all the people that go gluten-free, but you've still got these other grains. You still could be causing yourself trouble.
Yeah, quinoa is kind of like this. It's a pseudo seed. So it's kind of like not quite a grain, not quite a seed, and it has some similar amino acid sequences similar to gluten. So you definitely have to be careful of it. It may be a good gluten-free food to slip in there as a cheat every now and then once you're clean and you aren't reactive. But, definitely when you're trying to cut things out, that's something that you want to have out for sure.
Yeah. Let's answer a couple questions. Robert, he said, what's the topic? Well, this is Memorial Day topic.
Oh, functional medicine on demand. Oh, by the way, I pushed this topic at PaleoFX. I went to go see I told you about this on Box here.
Tell the listeners though, because it made my day.
Yeah, it was great. So I went to go see a thyroid presentation at PaleoFX. I was sitting in the crowd and the speaker for the presentation didn't show up. I think he's issue with his passport. So I asked the presenter, I go, hey, I'm going to jump up on stage. I'm going to give a thyroid talk on Sunday. Let's just do a functional medicine on demand thyroid talk. So we jumped up. I jumped up on stage and I said, hey, by the way, this is going to be thyroid functional medicine improv. So name 5 topics on the thyroid. Let's go. And I went on for an hour and just riffed on it. And it was a really good talk. And we did it again on Sunday as well. So dropping knowledge bombs, trying to take that same vibe here, functional medicine on demand, functional medicine improv.
What were people asking about? What was like some of the big takeaways from that?
Yeah, most people always ask the same stuff because, people resonate with what's affecting them, right? So thyroid and autoimmunity, thyroid and adrenals, thyroid and gluten, thyroid and iodine, thyroid and infections, thyroid and leaky gut, thyroid and toxicity. Those are always the things. I mean, we could literally just talk about those topics probably all day. We could do like an all day Google Hangouts and make that happen.
Yeah, for sure. So let's answer Robert's question. He said, hey, Evan, I remember you said I had an anxiety attack while watching a movie in the theater. The same thing happened to me last week. Any chance on what that might be? Yeah, so that was when I was living down in Austin, super stressed, was working at the supplement company, doing the clinical stuff on the side, just overworking myself, not sleeping well, massive EMF environment, living on a 3rd floor apartment, just a bad situation. And I was watching Captain Phillips, and there was a very violent scene in that movie, and I started to have a panic attack in the movie theater. What could that be? To me, I mean, it's just your sympathetic nervous system is just overactive. But if you're being able to be triggered like that from a movie, then I would say look at your adrenals. What would you say, Justin?
Yeah, I would say number one, there could be something kind of subconscious there that's triggering something from your past, a traumatic event,
Ah,
those
yeah.
kind of things. I mean, I see patients where, they get in a car accident and then like, a picture of a stop sign, the movie comes up and it triggers that car accident. Whoa, that panic attack, right? So I've seen that happen before too, where they've had panic attacks because something traumatic happened and it triggered it. And it could even be subconscious where you don't even know it, right?
Oh, that's
Um,
true.
but a lot of these things tend to happen with a more stressed out physiology, right? The sleep may not have been great. Maybe you're doing some intermittent fasting that day. Maybe the nutrition's not great. Maybe you let some gluten slip in. Maybe there's a little bit more emotional stress happening in your life. And then it kind of everything culminates. And then you get this trigger because you're more susceptible.
Your
So
bucket's full.
So for me, like the key things are going to be like hydration, especially having adequate minerals, like dehydration, and those things are going to affect it. Poor nutrition or skipping meals, the sleep component, and then just significant emotional stress components too.
Well, and we didn't evolve with giant movie theaters that are 80 feet across and 50 feet above with massive surround sound systems. So part of it is just a mismatch of our evolution, our DNA. We're expected to be out in nature listening to the birds 99% of our existence. So, I mean, part of it's just, it's a crazy environment in a movie theater. Maybe you take some of this Adrenasooth tincture here, this ashwagandha-based goodie, and take that before you go to the theater.
I love it. I'm going to go grab some Adrenal Revive. Hold on one second.
Do it. So Samuel, what do you got? Let's see what you got. Show and tell. Functional medicine, show and tell.
So off the bat, we're just hitting some adaptogens here. Rhodiola ginseng, ashwagandha, eleuthero, a little bit of vitamin C. CCC. So that's good, man. Regarding what you just said there, just to piggyback on it, it's typically the stress, but it's typically the environment, right?
Yeah.
Like if you're well fed and you had good sleep, people can throw crap at you and it just won't bother you as much, right? End of a long day, you come home, you're picking up, crap that your kid left on the ground, you're doing the dishes, your wife comes chirping in your ear and you just get set off, right? A lot easier, right? So normally if you're relaxed, no big deal. So a lot of it's just the underlying environment. Low hanging fruit, man, for any adrenal issues, good quality adaptogens. We talked about this time and time again. Good quality adaptogens, of course, does not replace diet and nutrition and hydration and minerals. Of course not.
Yep. In terms of Samuel, his question is Roundup the same thing exterminators use? Depends what kind of exterminator. If it's a weed exterminator, yeah, but if it's a bug exterminator, no, they're using something else. I can't think of the ingredients now, but it's different, but still equally toxic. And the GPL tox that I run from Great Plains, it actually does test for insecticides, which is a whole nother category, and those are just as carcinogenic. So, man, I would never, ever in my past life or future life be an exterminator. It just seems like the toxicity risk is just too high.
Yeah, typically you're exterminating bugs, right?
Yeah.
That's the big thing. And by the way, like bed bugs too, like there's a lot of chemicals and stuff people use to knock out bed bugs. I talked to one of the people over at Chem Free Austin, and they actually have a non-toxic method. If you have I think it's the bed bugs. But one thing they do is they can come into your house and they literally heat your house up to like 140 degrees. And that's enough to kill the bed bugs too. And that's it's totally non-toxic. So I'm like, oh my gosh. So anyone out there that has bed bugs and you can't get rid of it, don't do the bomb. That's just terrible. Where they, tent up your house and they put all these toxins in there and you got to leave for a week. Do not do that. Do the heating method, get that thing heated up to 140, 145 or so, and, get out for a day or two. And that should kill it. That's why they say like after, travel, you can just throw your clothes in the dryer for like 20, 30 minutes, get it up to 140, and that will kill any bed bugs too.
That's a great suggestion. That whole house sauna. I like that.
Yeah, that's definitely a good way to do it.
All right, let's answer James' question. He first said, is there any way to test conventional fruit for toxins, glyphosate, etc., so we know what level of toxins are in our everyday fruit and veggies? I've seen some little gimmicky products out there that supposedly test what's in your food. You like scan it or you cut a little piece of it and put it in there. There's a couple cannabis companies where they were testing for glyphosate in cannabis out in Colorado, and they said you can also use it for food. It was something DX something. I can't remember what this little device was. But just if you can, just go organic. I mean, strawberries the other day, my wife picked up some strawberries. We were at the farmer's market. One guy had conventional strawberries. They were $2.99 for a big container. Organic, the guy next door was $4, $1 more. Certified organic, So I really think most people can afford the extra buck to go for it.
Plus, if you ran the nutrients in them, I guarantee you the nutrients are at least double.
Oh God,
So if you do the
absolutely.
math, you're actually getting a better deal if you look at it from a nutrient density standpoint. But number one, you can always, if you're not going organic, you can try to do the clean 15. These are the
Yeah.
foods that have the lowest pesticide residue: asparagus, avocado, cabbage, cantaloupe, cauliflower, eggplant, grapefruit, kiwi, mango, onions, papaya, pineapple, sweet corn, sweet peas, sweet potatoes. And then again, the dirty dozen. But I mean, for the most part, apple, celery, these are your ones that have the most toxic load, right?
Your
Apple,
berries.
celery, cherries, tomato, cucumbers, grapes, nectarines, peaches, potatoes, snap peas, spinach, strawberries, wheat, bell peppers, hot peppers, kale, and collard greens. Just buy them organic.
Yeah, I mean, strawberries are the worst. I think the EWG, they came out with their 2017 survey of produce. They said that the most toxic fruit or the most toxic produce they found was a strawberry, and it had 22 pesticides on it.
Yeah, just buy them organic. I mean, I went to Costco this weekend. I got like the Driscoll organic, like a freaking tub this big, man.
Like 10 pounds of strawberries.
Yeah, I got to make sure I eat them all. I got to, because they go bad. My wife's like, "Oh, let's do this. We'll save some money." I'm like, "Yeah, but half will go bad because we won't finish them in time." So that's the challenge. We got to go knock them out here today. So I'll have a couple of strawberries with some maybe coconut kefir or something.
You'll have to break your ketosis experiments then for strawberries.
Oh, I know too. I know, totally. By the way, I gotta check my ketones. I'll do that while we're chatting here now.
Okay, let me read a couple more questions here if that's all right.
Clean 15, dirty dozen, and just try to always go organic. And if money's an issue, just go frozen. Go frozen. That'll save you some bucks that way too.
Yeah, Whole Foods has a great deal. I think you can get 2 pounds of organic frozen strawberries if you want to go berries or blueberries for about $8, about $4 a pound.
Totally good.
Let's see what else we got. Frank said, "Hey, Justin, does coconut oil convert directly into ketones when you drink it?"
The fatty acids in there, typically coconut oil, you're going to get medium chain triglycerides, so typically between C6 and C12. So you got like caprylic, capric, lauric, and there's one more in there, the C6, C8, C10, C12. And these fatty acids are precursors to ketones. Now, coconut oil is 1/7 the concentration of MCT. So 1 tablespoon of MCT oil, 1 tablespoon of coconut oil, you get 7 times more MCT per tablespoon of MCT than per tablespoon of coconut oil. So coconut oil has other benefits to it. You'll get some MCTs, i.e. ketones, but you'll get more if you just do pure MCT.
Yeah, it seems easier, and the cost has come down so much on MCT. If you can go straight coconut, if you can, try to avoid the palm. Save the orangutans, please. There's already enough deforestation over there in Indonesia where the palm oil is coming from. So try to go like Now Foods. I was kind of disappointed with Now Foods. They do palm and coconut source MCT, so that's crap.
Yep, exactly. I've been doing the Jarrow version or the Crayon version because they just do the pure coconut, which I like.
That's great. All right, let's see what else we had. James said, "Is there any way to get an organic acid test and results without a consultation and follow-up protocol? Just trying to figure out your baseline." Yeah, you can always go to Justin's site, justinhealth.com, or my site, evanbrand.com, and you can order testing. And you can order it. And if you want to try to figure it out yourself, you can. If you want help, we're here to help.
Yeah, typically myself, if it's just the organic acid test, I don't mind having a patient do that without a consult. If, we see more, if we're doing a test that kind of can reveal maybe a pathology like an infection or a severe thyroid imbalance, I just don't want the liability of someone having something and then not having the support afterwards and thinking, "Oh, I'm okay," or this or that. So that test tends to be okay because it's looking more at functional stuff, but you can still see pathological stuff on there.
Right. And if you know what you're looking for, you're using kind of the lens that we have to that test, we may find things that you're not going to figure out.
Yeah. Right here. By the way, 0.4 millimole. So I sit right around a half a millimole for ketones.
How do you feel about 0.4? What that means you're producing some? Is that you're mildly ketotic? Is that what you would consider that?
I like between 0.5 and 1.
Okay.
That's a good place to be.
Cool. All right. Robert said, "Shed more light on my situation. I had a parasite infection, recently tested positive for H. pylori. That makes a lot of sense into my anxiety comes from the stomach area. Evan, where did you feel your anxiety? Your chest, your stomach, your head?" I don't know, Robert, probably everywhere. I mean, I was a wreck. I had H. pylori. I had 2 parasites. I had Pseudomonas. I had Proteus. I had so much stuff going on in my gut. I honestly couldn't tell you. I would say I had anxiety everywhere because I was so systemically infected with even yeast as well. which was causing brain fog. And when you get brain fog, sometimes the brain fog actually triggers anxiety because you can't focus. So I was systemically affected. Riley, what are the best ginsengs for stress and burnout? I mean, all ginsengs are great, wouldn't you say, Justin? But they just have
Yeah.
different levels of stimulation depending on where you're at. And we're typically not going to push someone directly into like a Panax ginseng or a Korean ginseng because they may just be too strong. So we may have to do something like Siberian ginseng or what's called a Luthero, which is a bit more mild in terms of stimulation because somebody might get anxiety attacks if you go straight to Panax or Korean.
Yeah. So what you said, you have the Eleuthero, the Siberian ginseng, which I like, and you can use that long term too. And then also the Indian ginseng or ashwagandha, which is Sanskrit for to impart the strength of the horse. I love that
Really?
saying.
That's what ashwagandha is.
Yeah, that's what it is.
Oh, I like
Yeah,
that.
to impart the strength of the horse. So I like that. I like it because it helps with sleep. I like it because it helps with anxiety, and it has some long-term effects modulating the immune system too. Again, it's technically a nightshade. You're not taking a lot of it. So if you're really, really autoimmune, you may have to avoid it. But I think if you're autoimmune and you're having some issues, I think it's worth trying it and seeing if you react or not, because it's just a great herb.
Have you even seen anything? I mean, people say, oh, ashwagandha is a nightshade, be warned. But I've honestly never seen any antibodies go up for someone and using ashwagandha. Have you?
Well, I think the benefit is you're modulating a lot of the stress hormones. And if you're improving sleep and stress hormones and mood and circadian rhythm, I think, the benefit outweighs the potential risk. And I think it just depends how sensitive you are. Like if like you react with a little bit of potato or a little bit of tomato or a little bit of peppers, like you're very, very sensitive, even the smallest amount, then okay. Because remember, it's like the amount of ashwagandha you're getting is like probably a condiment size, right? A big sweet potato a big white potato, right? That's pretty big. So if you react to that, well, you're just having just a pinch of that in the ashwagandha, maybe 1 to 2 grams, right? So probably not an issue, but always test it. Exceptions to every rule.
That's true. Yeah. And I mean, a lot of times you and I are using different tonics and tinctures and combinations of herbs. So ashwagandha may just be a part where we may only have to use 200 or 400 milligrams. But if that's in synergy with rhodiola or reishi or something, then you're still going to get a great effect and you're not going to be pushing the ashwagandha. So I really don't think it's worth fearing it in most cases.
Yeah, I got a new one coming out too called Ashwagandha Supreme. I was able to source it organic. Super important to get some of the herbs higher quality because of the pesticide residue. So I was able to source that one organic. That's Ashwagandha Supreme.
Love it. Love it. All right. So check out Justin's store. If you haven't, you can go justinhealth.com. There's a great healthy living store. I'm kind of jealous of the layout on there. I might have to steal some of your ideas with your inspiration there. You've got it so laid out. It's like GI health and immune. I mean, I like your little cubed layout you got there.
It's all about user interface, man. Keeping it simple.
Yep. Robert said the fact that really gives me hope. I'm 29. I've been feeling like this for 3 years. Yeah, I mean, there's some people that we work with in their 50s, 60s, 70s, 80s, and sometimes in their teens, and everyone can be susceptible to these infections. So now is a good time to fix it because if you've got H. pylori, as we know, the worst thing that could cause ulcers, stomach cancers, all sorts of stuff like that. So definitely knock it out. You don't want to just leave it alone. Have you had people argue, or maybe some of your clients that had their medical doctors say, oh, H. pylori, you don't need to treat it? I've heard some.
Yeah, I mean, I've had a lot of doctors, they won't even test for it. Like they'll just maybe run a breath test or they'll run their stool antigen test and it won't come back. But then they just think, okay, it's done. It's a non-issue. It's a nothing burger. But then we run some of our more sensitive tests on it and it'll come back, and it maybe even come back with some virulence factors, which are these cytological compounds that are produced by the H. pylori, which can actually create more symptoms or create more toxicity.
I did want to mention that. Let's spend a few minutes on that because I did want us to focus a bit on like testing. We hear clients so much that come to us and they say, oh, Justin or Evan, I've had XYZ test run. I've had this Genova test, or I've had this Dutch test or whatever. And they think that those are the end all be all, but we've seen many, many false negatives with different labs out there. So just because you've had testing run and you were clean 6 months ago, that doesn't necessarily mean that you're clean today. I had a lady who her gut was fine. She went to India just for 2 weeks. She came back and then she had blastocystis hominis, a common parasite we see. And there was only a 2-week difference in terms of labs. So you really want to make sure that your accuracy of testing is there and make sure that you're doing it regularly too. I mean, I even saw, I don't know if you saw that new company that came out the other day. I can't think of it. I'll have to get you the name, but it's a subscription-based stool testing company. Have you seen that?
Oh yeah, I think Dave Asprey was talking about that, wasn't he?
Yeah, it's like Vimy or
Yes. Yeah. I think he had that multi-billionaire guy on his show, and that was doing a lot of the venture funding for that. That makes sense.
we may need to reach out and see if we can run that side by side with the GI map and see what the
Oh,
comparison is.
totally. That sounds like a great idea. But kind of talking about you here again, H. pylori, but it could be other infections. I find some of these conventional panels, they tend to miss. I mean, I've had some people come back and they're like, because they're listening to us or listen to other people online, and they get their doctor, they pin them down. Hey, I want to get my insurance to cover it. They get covered and they come back with nothing. And then we test them and some other things pop up. But also we have some people that, an infection may come back on their side. Now I've retested on my side and more infections come back, right? So you got to really make sure you got to get your arms around that. Because if you get some infections going on there, you can't meditate that away. You can't diet that stuff away. You got to really get to the bottom of that and address it.
Yeah, a lot of people get frustrated with the fact that they're doing the diet piece, the AIP or paleo or whatever, but they've still not got the results they want. But you can't just drink a gallon of bone broth per day and magically make infections go away. If they're there, you've got to take care of them. And typically herbal methods, not the quadruple therapy, which is a conventional medicine approach to H. pylori. It just doesn't work. I had a guy do it and he still showed up positive. So I know it doesn't work.
Absolutely. Plus, you have the other side of the fence too, where, like you mentioned, you could just overly give more nutrients, give more probiotics, give more digestive support that won't knock out the infection necessarily. Plus, infections are going to create stress in the nervous system, right? Like the gentleman that talked about the panic attacks in the movie theater, you can kind of have this constant low grade stress. If you got like this infection going on and you got LPS that's dumping out, all of those things can be a stressor on the body. So we got to get to the root of that.
Well, that's well said. I mean, you told me that too when I had H. pylori. I told you, I said, Justin, I'm not even an anxious person and I'm anxious all the time. And you're like, man, it's those nerves that are connecting to your gut. You were like, this is your nervous system being affected by the gut. And I was like, seriously? And then fixing my gut, now I'm back to my normal self. I typically don't get frazzled by things. And so it's a great place to be once you heal your gut to actually feel the difference in your nervous system. That stool test, it's Viome, Viome, Viome.com. But yeah, it's like $99 a month. And it looks like they give you 4 stool tests per year. It looks all pretty, but I care about the data. So if it's a great stool test, then we'll have to run it and figure out if we can get them on the show and discuss it. And like I said, compare it to the GI map. I'd be curious to see, do you think it's better? How could it be better? I don't know. Is it PCR based? Is it antigen? Is it both? I have no idea.
Yeah, I think it's definitely worth doing some side by side. I'm noticing the DRG is taking a major step back the last 3 to 6 months. Are you noticing that too?
Well, I'm not using the DRG, so I don't know.
Oh, okay. Got it. Yeah, I do that a lot side by side. So I'm noticing that stepping back.
Are you serious?
Just not picking up similar infections that it used to. And when I compare it to other tests like stool antigen tests that we know something's positive with, it's missing a lot of things.
Really?
Yeah. I mean, we're in the clinical trenches every day. We're trying to figure out what works, right?
Yep. Yep. James says, who do we listen to on YouTube for good functional medicine information and inspiration?
That's a great question. I mean, I just kind of skim through what's hot, what's trending, and I'll scroll through and read some of the transcripts. If people are referencing studies, I'll go through some of the studies and just make sure, it makes sense. But Chris Kresser is obviously good. I'll listen to some of Rob Wolf's information and just kind of go through and just see what's trending out there and just do some Google searches and just see what's popped up there. I mean, thyroid, I like Isabella Wentz as well. She has some really good stuff. And then just really, I mean, the most part though, like, clinical knowledge and clinical information is so important because you can have your head in PubMed all day long. But again, how that actually is going to affect your patient and help your patient get better. I mean, we're constantly doing and trying things that allows us to know and get instant feedback of what's working and what's not. Plus, we have a clinical working model. I mean, it's taken us many years to get that working model and how we plug things into it. Because if you don't have a clinical working model, you got all this information, but how do you work it into the patient's care? That's the hard part.
I know. It's like, oh, look at this article on vitamin B12 deficiency and MTHFR genetic defects and vitamin D. And then this is why people get so confused. And they're like, well, what the hell do I do? Because you've got 50 different blogs telling you that every nutrient that you're deficient in is the root of all evil, or your MTHFR genetic defect is like the biggest problem in the world. And really, it's just one piece of the puzzle. So there's not much. I mean, and tell me if I'm speaking for you and it's not accurate, but there's not much that you and I find out there that really moves the needle for us in terms of new information, allowing us to have more clinical success. Like we've had our protocols, working and working and working on people. So most of the learning we're doing is more in the trenches rather than, oh, this new study came out about turmeric and now we're going to do something differently.
Yeah, I mean, I agree. I think you get far more knowledge talking with the clinician for 15 minutes and say, hey, what are some things that you're doing that's really moving the needle clinically with your patients? A 5 or 10 minute conversation will get by far more applicability and practicality than sticking your head in PubMed for a couple of weeks.
I like the studies. It's cool to see stuff that we think about. Oh, the benefits of omega-3s helps to prevent inflammation in the brain. It's like, okay, cool, but we were already doing that. So that's not going to change anything.
Yeah, most people go to PubMed anyway with kind of a suspicion on something because they're like, oh, I did this, that helped, or this helped. And they go there and they're like, H. pylori and this, or insulin and this. And there they find all this information. So I think it's good. I think you can learn so much just by clinically trying things and then going to the research afterwards and saying, hey, has the dot already been there connected?
Yeah.
Right? Because there's so many dots that are already connected in the literature. How do you put that into your model? How do you make sense of it without getting system overload? That's the hard part, right?
Or you just get tapped out because now you think you've got to take 35 different supplements and you might not.
Yes. So having a filter, right? Because, you learn about B12 this week, you read a study on it. Great. Now everyone you see is going to that filter of needing B12, but that may or may not be the case, right? So you got to have that filter.
And the B12 may make you feel 2 to 3% better, but what if you had Citrobacter or you had Klebsiella affecting your thyroid and that's 50% of your issue? You're going to need more herbal support for the gut. The B12s, not going to do much.
Here's a secret, right? A good clinical model, a good sound clinical model, and good communication with the patients and working on the foundational pieces while addressing the body systems on top will help 80% of all patients.
Yep.
The rest is all nuanced. Is there an infection? Is there an infection that's deeper that's being missed? Is there some kind of mold or mycotoxin issue? Is there some kind of unresolved emotional stress the patient hasn't told you about? Is there an underlying toxicity or heavy metal thing that hasn't been looked at yet? Or is there a rare kind of autoimmune thing and the patient's letting gluten slipping? And those where it kind of gets a little bit, that's where the clinical skills, the clinical samurai skills come out. But the 80% that we work on, that's the stuff that I want to keep solid because that allows me to help 80%. And then we continue to work on the 20%, but that's going to be more nuanced and more specific.
Yep. I know we've got to go right here. We've both got calls coming up in a minute, but Robert, he asked about that I take Dr. J's line of supplements to rid the infections and can I list the herbal protocol? Definitely I can't list the protocol because
depends on the infection. Yeah,
it depends on the infection. I could tell you what, some of the things that we use. We use garlic, oregano, olive leaf, berberine, barberry, bearberry, grapefruit seed extract, clove, thyme oil. Mm-hmm. Wild indigo, yarrow. But it depends.
Mastica, silver, ginger.
Yeah. And this is why clinical presentation, clinical research is always going to be necessary because there's never, ever going to be protocol A, protocol B, protocol C, because if you've got H. pylori plus Pseudomonas, or you've got Blasto plus yeast, and then you've got yeast plus Citrobacter, and then Citrobacter plus Klebsiella plus Proteus, plus you're low in all your beneficial bacteria, and then over here on your organics, you've got mitochondrial issues. It's like there's 3 bajillion combinations of everything.
Totally. And then you got biofilms. That's why I'm a huge fan. All my patients, ginger tea, because if it's biofilms, it's like taking the shield away from the Spartan soldier, right? Less chance of them being able to protect themselves.
Yeah, so you could take all the supplements we just listed and maybe still show up positive for H. pylori, right? So that's why I like the idea. I like the whole paleo functional medicine community. Yes, let's handle this stuff ourselves. But I did it the hard way, man. I had a supplement graveyard. And I was taking this and taking that and playing with that. But it's not until I got the clinical data, Justin said, dude, get your stool test. You got infections. I had to do it. I had to dial in the protocols. Justin helped me dial in the protocol. And now I'm infection free. So I don't want you to think it's that simple. If I could just, here's my protocol. Here's the magic formula. If we were able to do that, we could just publish it and say, look, here it is. But there's never going to be that because there's a million different combinations of bugs.
Yep. So depending on the bugs, we have set protocols that we may go back and forth with for sure. We have maybe 3 or 4 layers down each so we can move it around in case we don't address the infection. And then, looking at, like for instance, my protocol, what are some foundational things that should be in everyone's protocol? I think just a good multi, that's your insurance policy, right? You drive around with, insurance in your car. I mean, you may even have health insurance too to prevent, catastrophic accidents. So you have your multi, which is your good insurance policy to fill in the gaps with your diet. You may add some extra fish oil in there, maybe a little bit of vitamin D. And then after that, it's going to be, if you're really stressed, maybe you add an adaptogen. And then after that, it's going to be specific nutrients that you're deficient in based on testing or clinical symptoms, and or digestive support if you're not digesting well or you have a history of infections or just eating while stressed. So that's kind of how I look at it. And then you can plug and play everything. So if you want to bring in a heavy metal protocol or a detox, or there's a thyroid issue or an adrenal issue above and beyond, you can plug and play those things based on what comes back in the labs.
Yep. Well said. Well said. James, he said, what are we eating today for breakfast, lunch, dinner? We'll probably have to save that because it may be too long-winded. We may do a whole podcast about.
I'll hit mine real quick today.
All right, hit it.
Yeah, today just bulletproof coffee and collagen, butter, MCT, collagen. Right now, what I'm going to do is some kielbasa on the grill. I'm going to go do some sauerkraut. I may do a kombucha. And then tonight, what do I got tonight? I think I got some grass-fed keto burgers with some spinach, and then maybe some green beans and some grass-fed butter and sea salt, and then maybe some 90% dark chocolate for dessert, and maybe a few strawberries on top of that. Organic.
Oh, good job. Good job. I've got some strawberries too. I did do some strawberries. I did grass-fed beef with some broccoli with a bunch of different herbs and salt on that. And then I did just a little dose of some kettle and fire bone broth, chicken bone broth breakfast. I think it was just some pastured sausage. I don't remember if I did any blueberries or strawberries or anything for breakfast. Oh, nice. And a handful of macadamias too.
Nice. So, yeah, last night I did ghee and salmon, and then I got some big bundle of Costco organic broccoli that's already cut up. I love it because I can just grab it and throw it in the steamer. Steam that thing up, some butter on it, sea salt, done. So broccoli, ghee, and salmon and some sea salt. Phenomenal.
That's yummy.
Ready to go, man. Put me in.
Yep. Well, stay tuned, people. Subscribe for more. We will be back.
Oh, last question here. Canker sores, gluten. My biggest gluten detector is canker sores for me. And imagine if you got canker sores on the outside here that you can see and feel because they're pain, right? Imagine what's happening inside your body when you can't see it and you got 30 feet of intestines that are there. Who knows?
Oh, Lord. K Gupta, got to go gluten-free if you're not already. If you've already gone
grain-free.
Yeah,
grain-free.
Grain. Exactly.
Awesome.
All right.
Evan, my man, great FAQ sesh, brother. We'll talk real soon.
Take care.
Take care. Bye.
Bye.